As promised to our SABC News as well as SABC2 viewers, we take you live then to Pretoria to the Basic Education Department, where Minister Angie Motshekga is set to give a briefing right now.
The progress made especially for the basic education sector. As a sector, we had appealed to Cabinet and Department of Health that teachers should be prioritized, and we are excited that our request has been heeded. The request that we have made was informed by a number of factors, including the fact that
the volume is very low. What's going on?
As a direct result of COVID-19, the sector has suffered severely in terms of learning and teaching, and we feel that the ongoing instability in the sector is not very helpful for our country even in the long term. We know very well that it is a very difficult act to balance learning and teaching vis-a-vis the health needs of our people. CM in its meeting this morning did welcome the announcement by the President that vaccines for basic education have been secured. We want to take this opportunity to thank the President, to thank Cabinet, and also to thank the Acting Minister of Health, Ms. Mamuloko Kubai-Ngubani, for also supporting us with the vaccination program. As a department, we've been working in partnership with the Department of Health. We've been working around the clock to finalize a plan on the vaccination of our educators and support staff. We've been working very closely with all our different stakeholders who also have contributed immensely to the success of the vaccination program. Subsequently, in the CM meeting this morning, we also had consultations with our other key stakeholders in the sector. I had meetings with teacher unions this morning, the National Association for School Governing Bodies, and also governance structures which run our schools for children with special needs. I also had a meeting with independent schools. I had a meeting with South African Principals Association to appraise all of them on the latest developments with regard to the sector's report to COVID-19, but also to update them on the progress around the vaccination of educators. With the support and guidance from the Department of Health, the vaccination program for DBE will unfold with immediate effect. And we're urging all our teachers to say, and everybody else who's in the sector, to say, let's pull all stops and make sure that we do vaccinate all of us in the sector. Dr. Granville will give more details around the vaccination program. It will start the Wednesday, the 23rd, which is next week, and continue until the 8th of July when we close our schools. We will be vaccinating all teachers in the PESA, which is where we register our educators, administrative and support staff, irrespective of age. We'll also be vaccinating, this I thought I should raise because it kept on being raised in the morning. We'll be vaccinating even teachers who are school governing body appointed teachers and those employed by independent schools. That's why we also had a meeting with them to make sure that we have a comprehensive program of all the educators in the sector. In total, for the next 10 to 14 days, we plan to have almost 582,000 people in the sector vaccinated. And there are stringent guidelines which we have been given by health that if you are on a PESA, your details have already been captured on the electronic vaccination data system. Also, we have received the list of SGB appointed educators and from independent schools, but also using the information that we have from SABC. We want to emphasize that we will not, or the system, not even us, will not allow an on-site registration, meaning that persons not bulk uploaded on this vaccination information system, they cannot be registered on site. Therefore, which means they won't be vaccinated. And this should, if it should happen that you are not vaccinated, you have to go and register and come back having been registered on the system. The Department of Health and Basic Education at provincial and district levels will work together to link schools with the identified vaccination sites which have already been agreed on. The verification of basic education staff where the electronic vaccination data is offline will also make a plan to make sure that indeed we ensure that the vaccination process goes very well. We also want to note the following exclusions so that people are aware and they don't present themselves, that if we have had contracted COVID-19 in the past 30 days, health says you can't be vaccinated. If you already have been vaccinated, like myself, with Pfizer or under the Sisonke program, you can't be vaccinated again. And any person who had received a flu vaccine in the past 14 days won't be vaccinated. In our deliberation with health, it was further agreed that the vaccination program must cover staff that transport learners, our staff which is in the feeding scheme, our staff in the trade union movement organization, and also want to emphasize that vaccination is voluntary, but highly recommended so that everybody can be protected. And we want everybody to work with us to fight against COVID-19. And everybody is expected to make their own transport arrangements, but coordinated with the schools. We don't want anybody to wake up and the principal hear that we have gone to vaccinations when there have not been proper arrangements. We'll coordinate properly as a sector, we'll coordinate with the schools, we'll coordinate with the Department of Health. So in the next 2 weeks, we want to make a clarion call to all our school communities that they must drop all and vaccinate. In order for us to successfully complete this program, we'll need to keep schools open, and any disruptions we think will be undesirable. Vaccination of everybody in the sector is an opportunity for us to normalize and begin a process of mitigating on the impact of COVID-19 on our sector. We feel that we have to need to work extremely hard around the clock to vaccinate as many people as possible in the sector. But we also want to emphasize, which is what health also asks us to do, that vaccination does not mean that we must stop adhering to non-pharmaceutical health and state protocols. The scientists and the Department of Health told us that the vaccines do not provide 100% protection against the virus. So even though they are very important in the fight against COVID-19, but we should strictly adhere to the non-pharmaceutical measures to curb the spread of the virus. So on the management of COVID-19 cases in schools, we also want to urge schools to apply the standard operation procedures when managing COVID-19 related cases. Every school must have a COVID-19 committee, and they know that, a COVID file, and a compliance officer. And I said earlier that doing business under COVID-19 means that one needs to also strike a balance between saving lives and livelihood. In the case of the education sector, it means we need to do all we can to protect potential academic disaster. At all times, we follow the advice of public health who are supporting us in the management and the impact of COVID-19. And as a sector, from all the meetings I had this morning and even before, we are of view that schools must remain open. And saying so, we're not insensitive to the concerns raised about the rising infections. The position that we want to, which we will be presenting to Cabinet and also to the National Coronavirus Command Center, is that COVID cases must be handled case by case in a differentiated approach, on a province by province, school by school, and therefore if there is an outbreak, the school must be handled there, and it cannot be nationalized for any other reason. So while there are disruptions in the sector, the majority of our schools remain fairly stable. And I also made the example in the morning to say just this week we had reported cases of 100 schools which were disrupted. And in the sector we have more than 25,517 schools. So which means 25,500 schools or 400 schools remain stable. And on that basis, that's why we're saying let schools and provinces handle any outbreak or any problem school by school, and not really expect that we'll shut down the system because of, yes, the cases that we have been witnessing this week. We also noted that last week, because the infections were high in the Northern Cape, there were more schools disrupted. Because the cases have dropped in the Northern Cape, less schools are disrupted. This week, there were higher cases of infections in Gauteng, more schools were disrupted. And that's why we say, let's handle the matter case by case. But we also agreed that we will take guidance from structures such as the Ministerial Advisory Committee of Health, the NCC, the Cabinet on this matter, and we will continue to monitor the situation on a weekly basis and make sure that we don't risk the lives of our educators and our learners. So again, on the reopening of schools, if you recall that on the 28th of May 2021, as a department, we issued a government gazette in which we announced that primary school learners will return to school on the first day of the third term on the 26th of July 2021. So the decision, we canvassed it adequately within the sector with our key stakeholders who made inputs in the process. And indeed, we continue to be guided by various studies which looked into the teaching and learning losses already suffered by the sector, but more important, by scientific evidence regarding the impact of COVID-19 on younger children, as well as advice from the medical fraternity. So Cabinet did approve and supported the proposal by the sector to prepare for the return of traditional timetable at primary schools level with effect from the first day of the third school term, which is the 28th of July 2021. We gave ourselves 2 months to prepare for this mammoth task. At the moment, provinces are at various stages of being ready in terms of the return of primary school learners to schools on a daily basis. We are aware that there are many variables that will make this task a success, and DB is currently holding one-to-one sessions with provincial education departments that, again, when we reopen in July, indeed we are ready to receive all primary school learners back to school. On learner support programs for the academic year, I'd like to take this opportunity to remind parents, guardians, caregivers, and our children that the department and its partners continue to use alternative means of providing curriculum material. Again, we have repeated the Water Matric Catch-Up Program and Tswelopele campaigns, which we run through National Education Collaboration Trust and their partners. There are national supplementary remote learning campaigns developed to support the 2021 matric learners and learners also in the other grades, in the other phases, because we desperately do want to recover the losses that we continue to endure because of the difficulties of having our learners every day at school. So the 2 campaigns that provide digital and non-digital learning resources in partnership with a range of content providers through the DBE TV and OpenView channel 122, SABC 1, and DSTV Catch Up, and the YouTube channels, as well as digital and mobile chat platforms. These platforms were put in place to minimize the negative impact of COVID-19 on learning and to provide further learning opportunities in the context of the restrictions that are currently in place. We also have what we call the Second Chance Matric program, which is proceeding well. These exams started on the 26th of May this year, yesterday, and they will continue for the next 13 days. So the only concerns that is facing us was also the protests which were in different parts of the body of the country, which disrupted some of the work that we have to do. So the department is looking at other options to assist the candidates who had missed their supplementary exams. I really want to take this opportunity to thank all MECs in provinces, heads of department, in the provincial departments, our social partners and stakeholders, and our colleagues in the sector, to also, as I say, which I've started doing, to thank the President and the Cabinet and the Acting Minister of Health for the support that they gave around vaccination. And because, Elijah, the main purpose really was to share information on our readiness around the vaccination of teachers, I'm going to ask Dr. Grenville just to share information with the public as to what is happening, because we want people to spread as much information as possible around the rollout. We have set ourselves only 10 days, and therefore we need all the information to reach people in good time. So, Chair, I hope you will allow me to ask Dr. Grenville to share information on the rollout of the vaccination for the sector. Thank you very much. Okay. Mask. Okay. Right.
So that I can see the slides. Yeah. Good afternoon, everyone. Thank you, Minister. So I will just provide the details in terms of the program that we'll start rolling out next week. So we have been offered by the Department of Health an initial number of 300,000 doses. During the course of the week, the Department of Health communicated to us that there will be, in fact, more doses available to the Department of Basic Education. As Minister said, there was agreement that the vaccines will be made available to our sector, and the President has confirmed that. 300,000 doses of J&J arrived in South Africa on Thursday, the 17th of June. We do expect that additional doses will be made available and that those will arrive in the country next week. Together with the Department of Health, we've agreed that 280,000 of the additional doses will be made available to basic education. And these doses are expected to only expire on the 8th of August, which means we'll have enough time to do the vaccinations. And as we've agreed that we will conclude this particular program within a period of 14 days. So just in terms of the process, the vaccines have arrived. They're now being tested. They will then be released by Sunday this week to the provinces for distribution Monday and Tuesday. And as Minister has indicated, the rollout will formally start on the 23rd, which is Wednesday next week. And it will then be concluded the day before schools close on the 8th of July. Just in terms of the target population,